Meeting you where you are. The meaning behind the slogan is that we meet the community where they are, on their journey towards holistic health, a plant-based lifestyle, and veganism, whether it's physically, mentally, emotionally, or spiritually. We do this through people, food, events, and culture. Our 6 pillars are birth, eating, education, empowerment, enlightenment, and events. We are Black Veg Society.
Peace and blessings, everyone. Thank you for tuning in. Let me help you, a loved one or friend, find your vegan soul through food, people, events, and culture. February is Heart Health Month. And did you know that your oral health care is directly related to your overall health? I have a special guest on today. Dr. Terry Victor is getting ready to let us know when visiting the DC dentist, each patient's overall health is taken into consideration when discussing each patient's oral care treatment. So welcome today's guest, Dr. Terry Victor. How are you doing?
I'm doing well, Naijha. How are you doing? Thank you
I'm
so
good.
much for having me on.
Oh,
Appreciate
absolutely.
it.
I love this conversation about oral health and the relation to heart. So February is my birthday month. So
All right.
I'm happy that this falls during this time because I love to talk about it. So tell us, how does heart health relate and connect to dentistry?
Oh, wow. Heart health relates quite a bit to dentistry. It might not seem like the two of them are related, but they are very much integral, very much related. So what happens is that bacteria, when you have bacteria from gum disease, bacteria can enter the bloodstream, and then that particular bacteria can also can cause inflammation. So when it causes inflammation, it can lead to cardiovascular issues. So one of the things that that is very important is that if that poor oral health, where you have like gum disease, it can lead to a higher risk of heart attacks, stroke, atherosclerosis, which is like a hardening of the arteries. And what they've also found with that through research is that the bacteria that's in gum disease, is also present in like the fatty tissues that causes blockages of your arteries.
Wow. No, I didn't know that. I didn't know that, Dr. Victor.
Yeah. So heart disease and dental health is really much related to each other. And part of what they're finding out is that the inflammation that's caused by the bacteria in gum disease is really the deciding factor that causes all of these issues with the heart disease, because once you start to get some bacteria and you get the inflammation causes a whole cascade of different things for your body to take care of, for your body to take care of, because now your body has to take care of this inflammation, and then that leads to a whole bunch of different things, and that's why you have like the stroke, and then you have like the heart disease, and then you have it raises your blood pressure. It does all of these different things, and they found that a good part of it, or a portion of it, is due to what's happening with your oral care. So the reason that that's important is that when you have buildup on your teeth, the buildup that you have on your teeth has bacteria in it, and that bacteria goes throughout your body. So if we're talking about heart health, that bacteria goes throughout your body, but it stops at your heart, but it also goes throughout your whole body. So it's not just your heart that is affected by this gum disease and bacteria that's in your mouth. It's systemic, because it can travel through your blood vessels.
My mother used to say that, and that's why she was adamant about making sure that me and my younger sister had our dental appointments. Like she was now
Yeah.
when I became an adult, that was a whole nother thing. And then, as you know, I the DC dentist is my dentist, folks. So you've done incredible work on my mouth, especially taking out the metal fillings and putting the other filling and then replacing the crown. So I can definitely testify to the work that Dr. Terry Victor does at his office, the DC
Thank you.
dentist. But you're a holistic dentist. What
Mhm.
does that mean? Explain that to us.
A holistic dentist, for my definition or our definition at the office, is you use alternative therapies in the dental practice that you use. So we use homeopathic remedies, we use supplementation, we use aromatherapy, we use all of these different modalities, herbal remedies. We use all these different modalities to enhance. Well, I shouldn't even say enhance, but to work with the dental work that we also do, because we you have to do dental work if you're a dentist, but those different philosophies kind of like mingle in with the Western dental, traditional dental training that we have, so that we're able to do something that's very good for our patients. And a lot of you would be surprised, Naja, how many patients are really looking for that, that really want, like, have an alternative perspective on their health, and they want to use as little as possible, drugs and those sorts of things. So it's worked out for us, that the patients seem to be happy with what it is that we're producing for them.
Well, you had me at aromatherapy, so as soon as you said that, that's right up my alley. I am definitely into. I'm burning a chakra candle and incense now, so I'm telling you, I love it in my lotions and everything. Definitely makes a difference. I can tell the difference between when I
Yeah.
have it and when I don't have it. What are some vegetables? Let's talk about the food
Mhm.
that helps with dental health. What are some vegetables that promote good dental
Oh,
health?
oh, yeah. I knew you'd want to talk about the food because you're into the food.
Of course,
There are
it's
a
all
lot.
about the
Yeah,
food.
all about the food. There's a lot of, first of all, there's like a lot of vegetables and fruits that are very good for not just your dental health, but also your heart health. So one of the things are like the leafy greens. So stuff like spinach and kale, romaine lettuce, collard greens. All of those things are like really good. They have calcium in them. They have iron in them. They have folic acid in them. Those are all things that are good for your teeth, good for your heart health, right? So if it because it's heart month, so those are things that are also good for your heart health, and then that you're able to use those things, and they're also natural. And I know you guys do like a pretty mean kale over there
Yes,
at Land of Kush, because I've had that one myself, and it was exceptional.
customer
So I'm sure
favorite.
that you're glad to hear that about kale, right?
Yes.
So yeah, those are some that are very good. Broccoli, bok choy, those are also really good. They're high in vitamins and nutrition. So they're also very good, and they help strengthen the teeth also, some those sorts of things. The crunchy vegetables like the carrots and celery and stuff like that, those are also very good for your teeth, because they're able to get you to bite on some stuff that's like very crunchy. And also the root vegetables, but root vegetables, like, I mean, like onions and maybe even garlic, those are very good. They're antibacterial. And if we're talking about having bacteria in your mouth, we had just talked about that. Those are also very good. They're also very good for your heart. So all of those vegetables, and if we can get organic, no antibiotics, no stuff in the soil, no GMO. If you can get those vegetables, then they're generally very good for you, very good for your teeth, and very good for your health in general. So we definitely endorse those things.
Yeah, I was just looking at the page in this FAST acronym that you have there. Is this in relation to if your oral health isn't in check, that this type of stuff happens? Um,
Y-
the face
Yeah,
drooping, arm weakness, speech difficulty, time to call 911. Those are some of the signs. And this stuff, this can happen if your oral health isn't up to
yeah,
par. I
yeah,
didn't know that. This is
yeah.
news to me.
You're definitely your oral health. It affects your overall health. So, but the issue is too is that the bacteria that's in your mouth, and then we all have bacteria in our mouth, but it depends on the extent of the bad bacteria and how much we keep that under control. That determines whether it's going to cause some issues in your heart or if it's going to cause some issues in the rest of your body. Or even they say that it even if it goes to your brain, it can cause like dementia and those sorts of things. Or I should say it could contribute to those sorts of things. So, we really want to make sure that our oral health is really in a good place if we want to get to the point where our overall health is in a very good place also, because you can't the two are linked, just like we see like our body as being at our office, we see our body as being holistic. It's not there's not a separation between your mouth and the rest of your body. Your
Right.
mouth is an integral part of it, and the rest of your body is an integral part of making sure that stuff in your mouth is healthy. So just making sure that all parts of your body is healthy, it really makes a big difference.
I mean, I'm sure a lot of people don't know this, so I'm hoping whoever's watching
Yeah.
definitely is taking heed and understanding the importance of seeing the dentist on a regular basis. How many times a year do
Yeah.
you recommend they see a dentist?
We recommend to either like about 4 to 6 times a year for you to get your teeth cleaned, because like I said, it really, your dental health could really influence your overall health. Another way that your dental health really influences your overall health is that if you have missing teeth, they did this big study, I think it was in China and one in France. And what they found out was that the more teeth that you have missing, the more it decreases your lifespan. So if we just think about that for a
Wow.
minute, and then so the reason
Whoa.
that is because if you're missing a lot of teeth, then you can't chew your food properly. And if you can't chew your food properly, then when you swallow it, your stomach can't process it properly. And then your body can't draw the nutrients from those foods to supply the rest of your body with the nutrients that they need. So then that could lead to like leaky gut syndrome. It could lead to
Mm,
all kinds of different other kind of issues because your body is not getting the nutrition that they need from your food. So, and all of that is because you're not breaking it down properly, because that's what the teeth are for. The teeth are the first step of digestion, right?
right.
So that if they don't break it down properly, then what ends up happening is that your body can't use it properly, and then you start to have like stomach issues, you start to have like all kinds of other issues. And that's why they said that that influences your lifespan, because if you could think that happens over like a number of years when your teeth are missing, then it could definitely decrease your lifespan.
Well, Dr. Victor, you know I have all my teeth because you've been fussing with me to try to get my wisdom
Yes,
teeth out.
yes.
So I don't have any missing teeth. So talk about that. Like I'm
So
gonna put
you're
my whole bit.
good.
Like folks, I still have my wisdom teeth. It's always every dentist I've seen. It's always been this bad. Can you kind of let's just touch on that a little bit? The wisdom teeth and the
Yes.
impact, the negative impact they can make, and when people really should be getting them out. Because sometimes, I've
Yeah.
heard you don't have to take them out if they're not bothering you. No, you need to take out. Can you just give what's your overall suggestion on this? It
I'm
depends on
sorry,
the
say that
patient,
again. I
right?
think you kind of dropped off a little bit.
No,
What was the
what is
question?
your opinion on that? About the removing of the wisdom teeth. I know it
Oh, the
depends on
removal.
the
Yeah.
patient, but overall, what is your recommendation or suggestion on that
My
with the
thought
wisdom teeth?
process.
Because I don't have any
Yeah,
missing.
that's a good question. My thought process on wisdom teeth are like, I don't just take out wisdom teeth for the sake of taking out wisdom teeth. If your wisdom teeth are fully erupted, I mean, they're fully out, they're functioning with your top and your bottom wisdom teeth are functioning with each other, and there's no pathology there, there's nothing happening with them, then I would just say just keep their wisdom teeth and have them function just like their normal teeth, which is kind of like what you have. Your wisdom teeth are there, they're functioning, then I wouldn't just take them out just because they're wisdom teeth. If there's like an issue with them, if they're like they've been causing you some problems, or sometimes with wisdom teeth, what happens is that the tissues around them swell up and can be painful, or if they're like at a funny angle, or if they're like close to the nerve and they're causing you some issues, then maybe we can look at seeing how it is that we could maybe take them out. But if they're out and functioning and they're doing okay, I have no problems with them teeth. They're there for a particular reason. So
Look at the work, Doctor. You took all the silver out. Folks, look at my teeth. So okay, that leads us to the question. If you want to keep your mouth healthy, what are some other things you should be doing? I know I need to floss more. Naughty me.
Yeah, flossing. Yeah, you need to brush and floss. And the people, a lot of times people won't have the issue with the brushing, but it's the flossing that they have the issue with. But it's the flossing that actually is probably, in my opinion, is more important than the brushing, right? Because the brushing gets on the sides of your teeth, the flossing gets in between your teeth, where that's where decay starts a lot of times, because that's where food gets caught. So because food gets caught there, you need to get rid of that food, and the brushing will not do that. I had a professor at Howard Dental School where I went, and he used to say, only floss the teeth that you want to keep, is what he said.
Wow.
Yeah.
I want to keep
So
all
that
my
was how, yeah. So that's how important he said that flossing was, because brushing will not get the places that flossing is able to get. So flossing is like important. So what I would recommend, if you want to be able to keep your teeth, the brushing and especially the flossing, and you want to be able to come to the dentist like every 4 to 6 months, just to get everything checked and to get like a professional cleaning done. And then just to make sure that you pay attention to your oral health, and that you pay attention to those things that you eat and you put into your body, like, because you don't want to do like a lot of sugary foods, a lot of sweets, because that'll cause you to have decay on your teeth, right? And if you do eat those things,
right.
you really want to make sure that you brush very, very well, because the way that you get decay, a cavity, is that sugary stuff sticks on your teeth, especially if it's
Yes.
sticky, like like something like
Gummies.
taffy or something like that. Yeah. So if it
Yes.
sticks on your teeth, then that's how the sugar starts to the bacteria in your mouth starts to eat that sugar, and it eats your teeth at the same time. So you really want to make sure you keep those things off of your teeth.
So if you had to leave the house and could only take one dental product, would that be the floss? So you got to leave the house. Only one thing can go between your toothbrush, the toothpaste, the floss,
Yeah.
the rinse. Would it be the floss?
Yes. So if it's one of those like end of the world that's coming and you got to go back and you gotta hit the road, then you have to floss is the way to go, because that will save your teeth. Even if you're not able to brush, you're able to rinse your mouth out, but the flossing is going to help with that, because that's the only way you're going to be able to keep from having cavities in between your teeth, which is where that they would start. So yes, my answer is floss, is what I would say.
Dr. Victor, it has been such a pleasure. Folks, I have the website up,
Mhm.
dcdentist.com,
Yes,
the dcdentist.com. I
the
apologize, the
DC dentist.
dcdentist.com. Please, you want to take care of your oral health so that your overall health isn't negatively impacted. How can we best
Yes,
connect with you directly, Dr. Victor, or with the
yes.
office? Let us know.
Yes. Yes, thank you. So you can reach us at thedcdentist.com, like you mentioned. Our telephone number is 202-544-3626. Once again, 202-544-3626. We're in the Capitol Hill area of Washington, D.C., close to Eastern Market. So right now, close to the metro. So Eastern Market Metro. So that's how you can reach us.
Dr. Victor, is always a pleasure.
Thank you.
And I need to get down there to get a cleaning or something, or a
Yeah.
checkup. And hopefully I'll be down there to do a demo of some of those leafy
Oh,
greens.
Oh,
that,
yeah. Bring the
people
kale.
eat. Yes, the kale salad. Yes. And show
Yes.
people what they should be eating.
Yes.
So, folks, thank you for tuning in again. You're tuning in to Naijha Speaks. Please
Yeah.
like, subscribe to the channel. This is a project of the Black Vet Society. So you can support the program by making a tax-deductible donation at blackvetsociety.org. Thank you so much, Dr. Victor. Have
Thank
a blessed,
you. Thank you so much.
day.
Appreciate it.
saving those
Yeah. Good to talk to you. Okay, bye.
Meeting you where you are. The meaning behind the slogan is that we meet the community where they are. On their journey towards holistic health, a plant-based lifestyle, and veganism, whether it's physically, mentally, emotionally, or spiritually. We do this through people, food, events, and culture. Our 6 pillars are birth, eating, education, empowerment, enlightenment, and events. We are Black Veg Society.